While Original Medicare covers many healthcare expenses, it doesn't cover everything. And co-payments and deductibles and even regular vision and dental screenings can really add up. So what's a healthcare consumer to do? Abby O'Brien has some suggestions. Abby is the Director of Broker Sales, Individual and Government Programs at Medical Mutual of Ohio. Welcome back to the show.
Great to be here, thanks.
So what are our options for taking care of these uncovered expenses?
Sure, so there are options in the market for Medicare consumers that are looking for ways to either fill those gaps or cover some additional services that Medicare doesn't cover. So there are really two types. There's Medicare Supplements that supplement Original Medicare and cover that 20% that isn't covered. And then there's Medicare Advantage plans. And those are an alternative way to accessing your Original Medicare coverage.
Okay. And there's differences between the two, I assume. So
there are.
Let's start with the Medicare Supplement plans.
Sure. So the Medicare Supplement plan, again, is going to cover those gaps that Original Medicare does not cover. So you'll still have your parts A and B, and it's going to fill in, again, that 20% that isn't covered and your deductibles. And there's the nice thing about Medicare Supplements is they are uniform company to company. Okay. The biggest advantage to a Medicare Supplement is it allows you to access any provider or doctor that accepts Original Medicare. So for flexibility, that gives a nice advantage so you don't have to worry about a network.
Okay, so how about prescription drug coverage though?
So prescription drug coverage is not covered in Original Medicare and is not covered in a Medicare Supplement. So you would want to go purchase a standalone Part D prescription plan if you were going the Medicare Supplement or Medigap route.
Okay, so then how do Medicare Advantage plans work and differ?
So Medicare Advantage plans are run by private insurance companies like Medical Mutual, and we have flexibility to structure those plans and build different benefits. You're definitely going to see more of a copay structure. So it's a different way to access that care. But in general, the same basic covered services as Original Medicare are going to be covered in those Medicare Advantage plans. One nice feature with Medicare Advantage plans is that we can add additional benefits like dental, vision, prescription coverage.
Okay.
But they do have a network, so that's an important decision that you have to make. Are you willing to stay within that network? Is your doctor in that network if you're going to go into the Medicare Advantage route and maybe take advantage of some of those additional benefits that you get?
Right. Well, there's a trade-off in both of them sense. So how about the Medicare Part D thing that we talked about for Original? You needed to have that. How about with the Advantage plans? So
with the Advantage plans, the Part D is almost always built in. So it's nice to have one plan that's going to cover your Medicare A and B services, your prescription coverage, and maybe some extra things like dental and vision as well.
Okay, some choices have to be made here. Medicare Supplement plans and Medicare Advantage plans are not the same. When deciding on which option is best for you, be sure you understand the differences, and then you can decide which one has the best advantages for you and your health situation. My thanks to Abby O'Brien for a clear comparison.
Thank you.
Find out more about Medical Mutual of Ohio by visiting www.medmutual.com/go or call 1-844-606-5387.